Hi, folks. Welcome to this webinar about open enrollment, sponsored by Community Health Options. I am a content strategist here on the team. My name's Marie, and I'm going to be leading us through some questions tonight. And I'm accompanied by one of our excellent account managers here, Becky. Becky, you want to just give a shout out and say hi to everybody?
Hello, everybody. Welcome to our webinar.
Thank you so much for joining us. We thought about what we wanted to do, knowing it's open enrollment season here for health insurance. And I myself have always really struggled and felt a little bit overwhelmed with health insurance and not really sure when to get it, how to get the right plan for myself. And so when I started working here at Community Health Options, I really got a crash course in all things health insurance. And so I wanted to be able to share my knowledge with you in case you might have some similar questions. So over the last few weeks, we've put out some posts on social media where we've asked folks like you to give us some of your most common questions, concerns, what really stresses you out about figuring out health insurance. And so tonight we're just going to take a few minutes and go through some of the most common questions and hopefully share some information. If you do happen to have any questions as we're going through, please feel free to drop us a note in the chat and we'll be sure to answer them at the end. So one of the most common questions we get is, why do I need health insurance? This for me was especially a personal question. Before joining Community Health Options, I was very overwhelmed by the process of open enrollment. It was something that really stressed me out. I wasn't sure how to get the best value for what I needed. And I just kind of tried to put it to the side. I figured I was healthy enough. It wasn't something I really needed to think about. And so there were periods of time where I just didn't have any health insurance. And I was kind of working on a hope and pray nothing goes wrong scenario. So one of the things that I do want to share, though, is that according to a recent survey, more than 40% of Mainers, like myself, do carry some form of medical debt. And that's one of the biggest reasons why health insurance is so important to consider. On average, people with health insurance will pay 50% less for medical services compared to those without insurance. So life is really unpredictable. A lot of us, like me, think, I'm healthy, I'm okay. I don't know why I need to pay $200-300 a month for this program that I might not use. But the thing about health insurance is when you have a medical emergency, it could really cost you. And that's not something you can ever schedule or predict or be ready for. A website that we really love here is comparemaine.org. And when you go on to comparemaine.org, one of the things they do is give you the average rates of what providers charge for some of the most common treatments. And I just want to share some with you that were quite eye-opening. And these are not outdated. These are things that we pulled over the last 2 weeks to share. Things like a knee replacement. I don't know about you guys, but as we're getting into the winter here in Maine, slipping on ice in my driveway, walking my dogs is a very common occurrence. Knee replacements can cost you $48,000. Stress test for your heart, $814. Colonoscopy, something that is not fun, not very many people look forward to, but is very necessary, $4,000. ER visit, one of the most unpredictable moments you can have in life. Nobody looks forward or tries to schedule going to the ER, but when you need it, you absolutely need it. And that's coming in at over $1,000. And that's not including any sort of labs that you may have as a result of being in there. And then one that is near and dear to my heart as somebody who had a C-section delivery myself, $23,000 for that delivery. The last thing you want to be thinking about when you're sleep deprived and handling your new bundle of joy is what those medical bills are going to look like when they hit your inbox. So all of these numbers are here just to kind of give you a sense of what the landscape looks like out there in the world and how health insurance can help start to cover some of that. One of the big questions that when you're thinking about health insurance is, okay, all right, I get it. I know I need health insurance. I understand it's the right thing to do, but I am still incredibly overwhelmed at how to figure out what's right for me. There's a lot of plan names, there's a lot of pricing structures, and I don't really get what any of it means. Most health insurance plans get broken up into these four main categories: bronze, silver, gold, or platinum. You may hear them referred to as metal levels. And when you're looking at these charts, and you'll see them on various websites, you can kind of Google a health insurance metal level chart if you want to see something similar to this. They'll all kind of follow the same format. So looking at our chart here, you'll notice on the top that there's a row of dollar signs. So that's your monthly cost. So a bronze plan, for instance, is going to have the cheapest monthly cost for you, whereas a platinum plan is going to be the most expensive monthly cost. It's going to cost you a lot more. However, you'll notice that on each plan, there's a secondary number. That's the cost for out of pocket if you need care. So on a bronze plan, that's for somebody who probably doesn't plan on needing a lot of healthcare services. Most important to you is you want that monthly cost to stay low. You're somebody who says, hey, I probably don't need that much care. And if I do, I'm comfortable paying for that out of pocket. On the other side of the spectrum, you might need a lot of healthcare services. You might be a frequent flyer at the medical offices, in which case something like a gold or platinum plan would be more accessible for you. You might end up paying a little bit more in your monthly costs, but when those situations do arise where you need care, your out-of-pocket costs are going to be much less. Becky, I feel like you probably can speak much better to this than I can from your level of expertise. Anything here that you would want to share about metal levels?
The only thing is, I mean, you have to go with what's going to be best for out of your pocket. If you, like you were saying, if you have a lot of medical costs, you go to the doctors, or you have a lot of prescriptions, you want to get a higher plan so you have less out of your pocket. And if you don't have any medical, most people do stay with bronze just so they have some type of coverage if there is a medical emergency.
Great, thank you. So you can see these sort of charts in a lot of places. We have one on our website as well, and it kind of breaks down all of the different plan information. But essentially what you want to think about is that relationship between monthly cost and your out-of-pocket costs. And you want to figure out what's right for your family, for your unique needs, and all of the medical services that you need covered. So now we've already kind of talked about, okay, I understand I need insurance because this stuff is expensive. I understand that there's different pricing levels and that I can decide and I have the freedom to pick. Do I want a higher monthly cost? Do I want to balance my out of pocket? But what about when I go and I actually start to look and shop for plans? That's a question that has come up very frequently for us. And it's something for me, I'll admit, at 40 something years old, I wasn't always clear on the difference between an HMO and a PPO, especially when they're followed by a bunch of different numbers, and then you're looking at deductibles, and it can all just get very overwhelming. I think the best place to start is just understanding what an HMO and a PPO are. So an HMO stands for Health Maintenance Organization. Now, when you're part of an HMO, what that means is that you're going to belong to somewhere where you have a primary care physician. And then outside of your primary care physician, you're going to need to get referrals to go see a specialist. So you're going to start at your primary care doctor. And let's say you need to get a skin check because you have a lot of freckles. Instead of you going to just find any dermatologist, you're going to work with your primary care office for them to give you a referral to a dermatologist who's in the same network. And so it's like you're kind of belonging to a village and you're going to stay within that village. And your primary care physician sits at the top and they help you kind of spider out from there. The opposite side of that is your PPO, and that stands for a Preferred Provider Organization. So in here, you have a little bit more flexibility. You don't need to get that referral first from your primary care. You could just go right to the dermatologist. However, if you do stay within that network, you tend to see lower costs. So it becomes a little bit of a balance of what your daily life is like, what your activity levels are like, and what sort of network you need for your unique needs. There's pros and cons that come to both. So this is where an account representative or a broker can be very helpful in helping you kind of think through what those networks are, and how wide the coverage is. I will say HMOs tend to be very easy to manage because you're in that structure of a specific network. It can make claims, it can make paperwork administration. Everything just seems a little bit easier because it all is laddering up to your primary care. On the other hand, a PPO is awesome for folks who travel a lot. If you don't want to feel restricted to one specific network, if you're a snowbird who likes to go down to Florida, it's great to have a PPO and have that opportunity to be flexible without worrying that you're going to get hit with additional costs. Becky, I know you're a Florida gal yourself. Anything here that you might want to add?
Yeah, I always make sure I have a PPO because I'm in Florida. If I do have an emergency, yes, it is covered, but if I need extended coverage after the emergency, the PPO will help us get the coverage that we need compared to an HMO won't because we're out of network. So yes, it just depends on your circumstances, whether you want, if you are traveling, I would definitely recommend a PPO compared to an HMO, which I always usually try to carry because I'm always traveling.
Great, thank you. So there's many other kind of tiers that come off of HMOs and PPOs, but I think starting to just understand those two, HMO, very specific network, has to go through referrals. PPO, wider network, you don't need referrals. As long as you keep those in mind, you can start to really make some decisions. You're looking at your metal levels for your price, then you're looking at your plan types for your coverage to try and balance both. A big question that comes to all of this is, can I even afford any of this? I think all of us here can really understand and feel the impact of our economy, of inflation. And when we have a lot of bills piling up, health insurance sometimes feels like it needs to take the back seat. And then when we know it can't take the back seat, it can get very, very stressful to figure out how you're going to manage all of this. What is great is that over 85% of enrollees typically qualify for financial savings. And there's a couple ways you can do that. One is through seeing if you qualify for tax credits. So tax credits help to lower the monthly cost of your health insurance. So if you remember back to our metal levels chart, where that first dollar line of bronze being the cheapest, but you have a lot of out of pocket, silver, gold, they have those higher monthly premiums. Tax credits help lower that for you. They can be applied to any of the tiers, and they can be taken in advance, or they can be claimed as a lump sum when you're filing your tax credits, your taxes. And tax credits are something that are calculated based on your household income. On the other side, there's also cost sharing reductions. Now, cost sharing reductions are something that are only available with silver plans that you purchase through the marketplace, which I'll ask Becky to explain here in a moment. What cost sharing reductions do is they help reduce those out-of-pocket costs for most of your services. And they're applied automatically throughout the year. So they're not something that you're going to claim on your taxes. Becky, where would you recommend folks go if they want to figure out their tax qualifications?
So you need to go into coverme.gov. They will actually have you fill out an application, put in all your information that's based off your tax forms at the end of the year, or what you're predicting you're going to be making through that year, the following year. And then that's where it's going to give you how much tax credits you are entitled to, which I always make sure people are very cautious and make sure that they don't underestimate it, because they do not want to owe the tax man come April 15th. So you always make sure that you try to get the correct your correct income in there, so you have the appropriate tax credits that you're entitled to.
Great, thank you. So that was coverme.gov is a great place for you to start to see what sort of financial savings and reductions you might be eligible for. And that brings us to our fifth question. I'm confused still. Who can help me? Here in Maine, we are so fortunate to have a wide variety of resources. In addition to a broker, if you already work with a broker on a current plan, or you know somebody in your life who's a broker is a great first step to help you navigate all of this. Outside of talking to a broker, there is the Council for Affordable Health Coverage. You can see the number here on the screen. They can set you up with an assister who is somebody that's going to help walk through some of the things that we've talked to you about today. They can help you look at tax qualifications, any potential savings, and make sure that you're getting connected with the right plan. As Becky just mentioned, coverme.gov is the healthcare marketplace for Maine, and it's run by the Maine Department of Health and Human Services. If you go to coverme.gov, you'll be able to enter in your information, you'll be able to shop a variety of plans, and it's a great first step. If you're not sure what else to do yet, and you're completely overwhelmed and stressed by health insurance, I highly recommend visiting either of these two websites and let them take some of the lift off of you. You don't have to do this alone. And lastly, our team, we're here. I certainly am not an expert in all things health insurance related. I am an expert just in chatting with you guys and knowing how to point you to the right people. But folks like Becky here are experts in this area, and they can answer any questions you might have. So I just want to make sure that you guys know that this is not something that you need to solve immediately on one step. You don't need to come to these phone calls with all of your paperwork lined up, with all of your decisions made. It is okay to pick up the phone and just say, I know I need health insurance. Now what? And then the people on the other line at any of these places or your broker will be able to help you get to that next step. They'll help you pick the metal level. They'll help you figure out HMO versus PPO. They will help you figure out any tax qualifications or any reductions that you might have. So don't feel like it's something that you need to come with all of the information prepared.
The other thing before you go any further, the coverme.gov, yes, you can call the 800 number and they'll help you fill out the application right over the phone. You don't have to be computer savvy either.
Oh, that's great. I didn't realize that. That's awesome. So even better. Don't even stress about going to the website. If you'd like to just call 1-800-636-0355, somebody will be able to help you. I just want to take a minute because I have noticed some questions come through our chat. So I'm just going to look and see if Becky and I can answer some of these for you guys. Becky, one question I have is, how do I know if my doctor is in the same network?
You will actually look under the plans and actually search whoever you decide to go with. You can look up your primary care physician or a specialist, or even your prescriptions. You can do it on a CoverMe when you're actually filling out the application. When it comes to the plans, you can type in your doctors and it'll tell you if they're covered. You can put in your prescriptions and it'll tell you whether they're covered underneath that plan, or you can go under the individual health insurance carriers and look up your different doctors too.
Great, thank you. And how long does it typically take to enroll?
If you have all your information right there, it usually only takes about 5-10 minutes. The biggest thing is making sure you're having your income and your social security numbers when we are doing it, to fill it out so we can get the appropriate information at the end for your tax credits.
Do you need anything like a driver's license or any sort of ID, just social security number?
Just social security number, date of birth, and names, and your income.
Great. Somebody has a great question here about how much does it cost to have a broker, and how much does the Council for Affordable Health Coverage cost?
Having a broker is totally free to you. So you do not have to worry about it. And with the Council for Affordable Health Coverage, it's also free.
Amazing. Great. So these people will help us for free figure out how to get onto the right plan.
Yes, we're here to help anybody.
I love it. Let me just scroll through and make sure I've answered all of them. Yes, we have. Great. Becky, anything else you want to add for folks before we say goodbye?
Nothing at this time. Just if you guys need help, make sure you get a hold of one of us so we can help you, or your broker.
Yes. Thank you all so much. Our intention was to keep this under 15 minutes. And although you may not know me in real life, I could talk forever. So I'm very proud of us for keeping this to only 15 minutes. Thank you so much for taking the time to be here. I hope this information was helpful for you. We will be sharing it out soon on our website at healthoptions.org. In the meantime, if you'd like to go to our website, we do have a variety of other resources that can help during the open enrollment process, from blogs to being able to browse our plans. We do have a provider directory similar to what Becky just described, where you could look up your current doctors and see if they're in network. You could also browse for your medications or pharmacies that you prefer. So everything is there. And if you have any questions, please don't hesitate. You can call us here at Community Health Options at 855-624-6463, or you can email Becky at bryder@healthoptions.org. So thank you all so much for joining us, and happy shopping during open enrollment. And we will be back and talk to you again soon.